Hello everyone, this is Dr. Nathan Kiskela, board certified family medicine and co-founder and president of Mark Medical. I'm here today with Dr. David Porzio. Thank you for being here, our medical director here at Mark Medical, to ask him some questions about what is on everybody's mind, and that is the coronavirus disease outbreak. Dr. Porzio, can you please tell us about the Corona 2019 or COVID-19 virus?
Yes, I would be happy to tell you about that, Dr. Kiskela. Well, COVID-2019 is currently an international outbreak of an upper respiratory illness caused by a new coronavirus.
Can you tell us where it began?
The center of the outbreak has been determined to be Wuhan, China, which is in the Hubei province.
Dr. Porzio, you said it's an internal outbreak. Has COVID-19 spread beyond China?
Yes, it is currently an international outbreak that has spread beyond China. There are 85 countries currently involved. Now, the good news here is that 80% of all new cases are coming from just 3 countries: Italy, Iran, and South Korea.
Has the COVID-19 virus spread to the United States?
Yes, Dr. Kiskela, I will have to tell you that it has spread to travel to the United States, but currently the outbreak here is limited. Now, because this is a very dynamic situation, the data on the current U.S. COVID-19 cases is changing daily, if not hourly. Currently, as of today, the CDC has reported 164 cases and 11 deaths in the United States. There's a total of 19 states currently reporting cases.
Well, Dr. Porzio, I guess the important question is, has the COVID-19 come to California?
So yes, it has spread to California. Now the data here is a little older, as I got it from the California Public Health Department, and they had not updated their data as of yet, but they are reporting 60 cases in California and 1 death.
What about the COVID-19 virus spreading to areas where we are present, where Mark Medical has clinics?
Yeah, so Mark Medical currently serves 3 counties: Orange, San Diego, and Riverside, with 11 facilities. Now, Orange County has confirmed 1 case due to travel. Riverside County has also confirmed a case due to travel. And as of this morning, San Diego had not confirmed a case, but apparently you had learned that they had a case in San Diego as well.
Yes.
So all 3 counties have 1 case. They're all related to travel, and they can be traced back to the index cases coming from China or the other areas. So I would have to say I'm pretty confident there's no evidence for an outbreak of the COVID-19 virus in our communities. There's no evidence for community spread in the areas that Mark Medical serves. Thankfully,
there does not appear to be a serious outbreak of COVID-19 in our service areas. Can you tell us more about the Corona 2019 virus?
So yeah, let's talk about what this thing is exactly. So coronaviruses are a very common group of viruses that have both animal and human hosts. These viruses can spread between humans and animals, and the COVID-19 is a novel or new coronavirus that has never been detected previously.
What are the symptoms of COVID-19?
So like many coronaviruses, the symptoms are of an upper respiratory tract infection and illness. You're going to have a fever, sometimes high. You might feel body aches, fatigue, nasal congestion, and discharge, as well as coughing. Now, if it spreads to the lower respiratory tract, it can cause shortness of breath, bronchitis, and in the more severe cases, pneumonia.
Is the coronavirus worse than the flu?
Yeah, that's a really, really good question. I'm sure that's a question that's on everybody's mind. We've talked about that a lot. Currently, we are learning a lot about this virus and the extent of disease that it causes. The experience so far is that it causes a mild flu-like illness in 83% of the cases. It causes a more severe illness like pneumonia in 16% of the cases, and it can be fatal in up to 1 to 2%. Now, what I have learned so far about this infection that separates it from the flu is its highly contagious nature. And it can be a more severe illness than the flu in people that are elderly or have chronic medical conditions like heart disease, diabetes, or lung disease.
Is there treatment for the COVID-19 virus?
Well, as of now, there's no medications available that would cure or eradicate the infection. from somebody who has it. Vaccines are already under development, but are easily 18 to 24 months away from when they can be used in the general public. So treatment therefore remains symptomatic and supportive, and this is especially true for those who require hospitalization.
Well, what can people in the public do to help avoid spreading the COVID-19 virus?
Yeah, so that also is a super good question, and probably the main thing we should say is the take-home message here. What I'm about to say holds true for all respiratory illnesses, not just COVID-19. And that is to say, wash your hands frequently.
Hand
Right?
sanitizer, yeah.
Hand sanitizer. We have a policy here at Mark Medical that when the provider walks in the room, he or she cleans their own hands and offers hand sanitizer to everyone in the room. So you want to clean your hands frequently. You want to avoid touching your eyes, nose, or mouth with your unwashed hands. You want to cough into what I call the germ jail. So the crook of your elbow. If you don't have a handkerchief or a Kleenex, just go there to avoid spraying the airborne droplets around. You want to avoid close contact with anyone who is already ill, and you want to stay home from work, school, public transportation, public gatherings, if you become sick with a respiratory illness.
Dr. Porzio, what if someone has symptoms of COVID-19 and they're concerned that they may have been exposed to the virus?
Well, the easiest thing you can do if you have symptoms of a respiratory illness and are concerned about exposure to COVID-19 is to call us. We have established the Mark Coronavirus Hotline. The phone number is 877-MY-DOC-NOW. That's MYDOCNOW, extension 2122. Or you can call 877-693-6266, extension 2122. And our staff will ask you a few questions to determine your risk of infection. If there is an immediate concern that you may have contracted COVID-19, we will contact the local health department for you to determine the next best steps. It is very important, and I can't emphasize this enough, that if you potentially think you have this infection, that you do not spread it to others. So please call us 877-MY-DOC-NOW or 877-693-6266, extension 2122.
Dr. Porzio, is there anything else? This is very helpful information. I really like that hotline. I think that's important for people to call besides just showing up at the urgent care. But is there anything else that you would like us to know, or anything else that you have to say about the COVID-19 virus?
Yeah, certainly, and I thank you for asking that question, Dr. Kiskila. And I think the most important message, or the most important thing, is to keep the COVID-19 outbreak in its perspective. First and foremost, there is no reason to panic. Concern is appropriate, but hysteria will not be helpful or productive. The outbreak here in the U.S. and specifically in California is very limited, and with everyone's vigilance, we can keep it that way. We must all do our part to limit the spread of all infections by keeping in mind the following. Now, I would tell everyone this: wearing a face mask is not going to prevent you from contracting COVID-19. But a healthcare practitioner wearing a face mask and those already ill with COVID-19 will prevent healthcare workers from becoming ill and spreading the infection to those who are not. Also, what we already said, wash your hands frequently, and we will do it again. Wash your hands frequently. Avoid touching your eyes, nose, or mouth with your unwashed hands. Cough into your germ jail, a handkerchief, or a Kleenex. Avoid close contact with anyone who is already ill, and stay home from work, school, public gatherings, and public transportation if you become ill with a respiratory illness. You must avoid all non-essential travel, especially to the level 2 and 3 countries, which include Japan, China, Italy, and South Korea. The disease is likely to be mild if you do contract it. So remember, if you have any concern that you may have COVID-2019, please feel free to call our 877-MY-DOC-NOW extension 2122 number, or 877-693-6266 extension 2122 if you think you have been exposed to COVID-19 and are experiencing symptoms.
Well, thank you, Dr. Porzio. That's very helpful. I know that we wanted to bring in one of our other special communication director, Bree Maloney, if she can come in, and she wanted to show us a few things for some people that have asked some questions, I guess, since we've been broadcasting right now. I don't know what those questions are, but Bree, can you come in and join us here and let us know what people are asking?
Hi there, everyone. Yes, so when I sent out this email and kind of put out the social media post that we were doing a video on COVID-19 update, we wanted to give you kind of the facts about COVID-19 that we already do know, but some of the things that you can learn on their website, but also some things that here at Mark that you guys can all use as well that you don't already know or you can find out from the CDC. So they have all said tremendous things, and I just kind of really want to reiterate that the potential here in the U.S. is still low, but it's never a bad thing to be prepared. So I kind of want to go over what we've already touched on, but proper hand washing. So you just want to make sure that you're properly washing your hands, not just running quickly through your hands with water, not properly drying, and then just leaving. You want to make sure that you use antibacterial soap, and you want to make sure that you're at least washing your hands with the soap for at least 20 to 30 seconds. And that may seem like a long time, and sometimes it is, but for you to kind of think of how long that is, you can sing the alphabet. Maybe not sing it, maybe hum it, or sing happy birthday twice. But you want to make sure that you're getting the back of your hand underneath your fingernails. And a lot of people focus on their palms, which is not a bad thing when they wash their hands, but one of the things that we usually touch the most with is with our fingertips. So we want to make sure that you focus on your fingertips. Again, back of the hand, and then when you're washing your hands, you don't want to touch the faucet with your hands. That just kind of doesn't, you might just get like more germs that way. So I always kind of use the back of my hands. A lot of faucets are, automatic, which is great, but you want to make sure that you're 20 seconds back in between your fingers, back of your hand, but then also you want to make sure you turn on the faucet, don't touch the sink, properly wash your hands, get all the soap off, but the most important thing is drying your hands. You want to make sure that you properly 100% dry your hands, because the wet, the more that you have water or like your hands are wet, the more that you can spread germs easily. So you want to make sure that you properly dry your hands. Now, when it comes to sanitizing, I recommend sanitizing often your workspace, your keyboards, your mouse, your monitor, but also your home, the things that you touch on mostly, but then also, your car, and things that you just touch every day. Now, the two things that I recommend are products that actually say that they do kill the human coronavirus. It's literally on the back of Clorox and Lysol. And to properly disinfect a surface, you want to make sure that you're doing it in sections, but what a lot of people do is they spread the disinfecting white on a surface, and then they use a paper towel to dry the surface. That completely does not kill any of the germs on the surface. You want to clean the surface, but you want to make sure that the product properly dries on the surface. You want to make sure at least it sets on the surface for 10 seconds or more so it could properly dry. You don't want to do the surface and then come back and dry it with a paper towel. You want to make sure it air dries. I think some people are hand washing all the way. Oh, perfect. And then Lysol, this disinfecting spray is really good, especially with toys, kids' toys, and other surfaces, because you can spray, but again, you don't want to spray it and then take like a dryer or like a paper towel and rinse off what you just disinfected. So you just want to make sure that you just disinfect the surfaces in the best proper way, because those are the best ways to disinfect and make sure you get the full benefits from disinfecting the surface. And then of course, if you do not have access to hand or soap and water or sink, you definitely want to use hand sanitizer like we've all done. We can do it one more time as well. But you want to make sure that you're just not doing this and then you want to make sure, like the hand sanitizer, you're acting like a soap. You want to go in between your fingers, your fingertips, maybe underneath your fingernails and your palms, and you want to make sure you rub until it is dry, because those will have the best effects of completely sanitizing your hand. So that is just my 2 cents on
Thank
proper
you.
hand washing.
Excellent.
Because it is very important. I know that it is a major topic right now, but a lot of people do not know how to properly wash their hands. And just to make sure too, I know that we touched on masks, and a lot of people have been asking questions, sending in questions regarding masks. And like we had said, that the masks will not 100% protect you from getting the virus, but I did want to reiterate that someone, we actually listened to a CDC webinar the other day, and he had noticed that someone at the airport was wearing a mask, right? But he said that he saw the guy touching his face 10 times more, adjusting the mask on his face because he was wearing a mask. So he was almost double, like he was giving himself more germs, thinking that he was preventing himself from getting, the respiratory droplets, but he's here touching his face, adjusting his mask, putting it, whatever. So you just...
And this was just after he noticed the guy touching the escalator
handrail, adjusting his mask, handrail again. So, we've just all said it before, you just want to avoid touching your mouth. Now, the only thing is I would say about the masks is, healthcare providers, they are necessary. And for those who have symptoms are good for masks, because I know that the COVID is going around, but the flu, we're still in flu season. So if you are experiencing flu-like symptoms, a mask is good for you as well. So not just, COVID-19, you want to prevent, because the flu, obviously any disease weakens your immune system, and that's what viruses do, or that's how you can help your body fight a virus, is to have a healthy immune system. So you want to make sure you're getting plenty of sleep, you're drinking a lot of water, you're keeping your immune system up and up and up. So that is my, that is what I wanted to say.
Well, thank you, Bree, for all your First Aid Friday facts there about washing hands, wiping down surfaces, wearing masks. Thank you, Dr. Porzio, for being here and giving us some valuable information. Remember our hotline. The best thing you can do, call us before you come in. Call that hotline. We'd love to talk to you. We'd love to bring you to the appropriate location, which may be our clinic, it may be the health department, it may be somewhere else. Call the hotline if you have any questions.
And I did want to reiterate as well that the CDC is updating their website daily, if not every couple hours. So to get the most updated information as well, I'm urging you guys to keep yourselves updated to protect you and your family. It's cdc.gov/coronavirus. So just keep yourselves updated. cdc.com/coronavirus. We are currently going through, I think next week we are actually launching a new website. So we will have a landing page with some of the CDC guidelines and things like that. But you do want to keep yourself updated. We will keep you guys updated as well as things get processed to us. Being in the healthcare industry, we are always invited to specific CDC webinars that not the general public gets access to. And so we will always keep you guys updated, and because our passion is your wellness, and we want to make sure that we are doing our due diligence in protecting our healthcare providers and our staff, but also to you and your family. So thank you again.
All right.
Thanks,
Have a
you guys.
good rest of the
Bye.
weekend. We will see you next week.